Well, hello, Dee.
Hi there.
How are you doing?
I am doing great.
Good.
Thank you.
Thanks for joining me today.
This is my pleasure. I'm looking forward to this.
Yeah, I have a lot of questions for you. I know that you're a myofunctional therapist and that you help people with oral dysfunction. And so, what I'd like to know is what is that? What is myofunctional therapy?
That's usually the question I get when
Yeah.
someone says, "What do you do?" And I say, "I'm a myofunctional therapist." And they'll go, "Aha." And then 10 seconds later, "What?" So,
What's that?
what's that? Yeah. So, I basically provide physical therapy for children and adults who struggle with oral function. And oral function, and I'll get into that a little more, but oral function is related to a lot of physical and systemic health conditions. And we can either prevent or we can repair or rehabilitate. So, what I basically focus on is whether the lips are doing what they need to do, whether the nose is doing what it needs to do, whether the tongue is doing what it needs to do, and whether it's resting where it needs to rest when you're not speaking. So I focus very much on lip seal, nasal breathing, proper swallow, and proper tongue tone and posture. And because we know those functions are related to a lot of other things. So, yeah, so I'll start with that.
Wow. Okay. So, how did you discover it, this type of work?
So, I'm licensed and trained and educated as a registered dental hygienist. And I did clinical dental hygiene for many years. And myofunctional therapy is a specialty where you take further training that is meant for dentists, dental hygienists, physicians of all sorts, um, physical therapists, speech pathologists, occupational therapists. And so we take further training. And during my time as a clinical dental hygienist, I quickly realized that, and we were trained in connecting the oral and systemic health, that it's the body, we're not two different bodies. The mouth doesn't stop there. And so over the years, I have always been very interested in the systemic in more than just providing periodontal therapy and prevention and caries therapy and prevention. And it pointed me in this direction. And so I took further education to do this.
Interesting. Do you still do the dental part of it or that's
I,
done?
I no longer do, but there are many myofunctional therapists who do. And you
Oh,
may even find dental offices who have a myofunctional therapist on staff within their
oh,
practice. So I happen to have my own private practice. And I no longer practice dental hygiene, clinical dental hygiene. But you may find myofunctional therapist in a dental office.
at least the dental offices have probably heard of that. So if I say, do you have a myofunctional therapist on staff? They'd go, oh, yes, we do. Or no, we don't. But they wouldn't go, what? What's that?
You would be surprised. You may still get a what? What's that? So, but no, it's true. Many of them, and it's especially orthodontists and airway focused. It's very the purpose is always to provide proper breathing for patients, and that's I talk about the four pillars like the lip seal and the nasal breathing. The number zero, I always say number zero is airway. So any dental office that is very focused and is very educated and aware of airway necessity as part of oral function will have heard of myofunctional therapists.
Yeah. And how would people know to seek you? Um,
So yeah, so some patients come to me via referrals from other dentists, some
okay.
orthodontists or general dentists, and some just hear about it. I think nasal breathing, there's been a heightened awareness of the importance of nasal breathing over the last several years. I think the book Breath that came out several years ago has brought the importance of nasal breathing to the general population. And so many have heard of it. I also think with the last 2+ years, where many of us have been wearing masks much more
Yeah.
than usual, we have been faced with the fact that we've had a hard time, some of us, breathing in the masks, and what that has done to our dry mouth. We suddenly have more cavities.
Oh, I never thought of that.
Yeah. And then when the mask comes off, we don't necessarily just close our mouths again just because we now can. So people are struggling with sleep has gotten worse because now they're mouth breathing at night, and that affects quality of sleep, etc. So I think the general population has become more aware, and they start looking at how can I help with this issue that I have now because I've been wearing masks more.
Wow, I never thought of that. And when I wear a mask, I mean, none of us like to wear masks. Oh, well, and when it's cold, I like it, but I get headaches. And does that have something to do with how I'm breathing in the mask?
It may very well that you are not
Ah,
getting. So when we breathe through our nose, we get a higher quality of oxygen and it goes through our bodies differently. When we breathe through our mouth, which we often switch to when we put on a mask, we don't get the same benefits. And we actually somehow can have a low grade hyperventilation without getting the quality of the air. And we dry our mouth and we tense our facial structures, which sometimes will then reflect up to different parts of our head,
yeah.
and our TM joints, that can then cause cavities too, but headaches. We shift our jaw sometimes if the mask feels funny, and we do something different that we're not used to, and suddenly we get these new symptoms.
Boy, we could do a whole show on just masks, wearing masks,
Yes.
how to wear masks and how to breathe in masks. So can you get the proper, can you breathe properly through your nose with the mask on?
Well, many people can, and many people can be trained, but when it comes to nasal breathing, some people can't even breathe properly through the nose without a mask. So one of the first things, if patients come to me because they've been told their mouth breathing, the tongue is low, their face is changing shape because of it, they come
Oh,
to me and they say, I think I need to learn how to nasal breathe. Well, the first thing I always do is test if they physically can, because for some, there can be structural issues. There can be a nose issue that can actually be structural reasons. If you have allergies and we just tell you to close, that results in congestion, then just closing your lips and teaching you how to close your lips will not have long-term benefits, because we need to address the allergies. If people have a collapsed nose, such as a little bit myself, it becomes harder to breathe through your nose. And so we have to address that, whether through little tricks or whether through surgery or whether through nasal hygiene issues. So you may not be able to breathe properly in your mask, but you may not be able to breathe properly without your mask either. So that's the first thing. So when they come to me, I do a very thorough assessment, and all myofunctional therapists do. We dig deep to look for causes and root causes. And we end up often being sort of a middleman collaborating with others, because if you come to me because you're having headaches and it may be due to mouth, and you're thinking maybe it has to do with my mouth or my breathing, I may end up suggesting that you should see an ENT first before we do therapy, or you
okay,
may
that's
need to see
good.
or a sleep doctor or an orthodontist or an allergist, or so I very much play a role of collaborator and advocator. So I advocate for you and I collaborate with a handful of other providers so that we look at the big picture before I start teaching you how to close your lips.
I think everybody would need this kind of training, right? There's probably a lot of people out there like this.
Yes.
That, and
And
that they don't know anything's wrong with, I mean, it's so interesting to find
well,
all of this out.
and just because something is common, I'm sure you've heard this one before, doesn't mean it's normal.
Right.
And another one that's very common is that we have a restricted frenum. So our tongue is physically kept on the bottom of our mouth, where it actually needs to go up on the palate for a series of benefits and growth. And so that one is very common, that we have what we call a tongue tie. You'll hear that that
I
term.
saw that. I thought, what is that? Tongue tied. I mean, I say I'm tongue tied because I can't think of the right words to say, but that's not what it really means.
Well, it actually almost does, because
Oh,
it means that when someone is tongue-tied, it means that the frenum, which is under the tongue, that keeps your tongue in place, is so short, is dysfunctionally short, that you aren't able to use your tongue properly. So again, in children, for example, if that happens, that means the tongue goes on the floor of the mouth, and that means it does their upper jaw. I have a little thing here. Doesn't get the development, that it doesn't get the growth. So our tongue and our lips and our cheeks and our nose, but especially our tongue, actually can move our jaw and can move our teeth, because it's a force. So when we have our tongue on the palate when we're children, it means that our upper arch expands.
oh my.
So the size of the arch will expand. Now, if the tongue keeps it down,
Wow. That's the big, wait, I have to tell people, you might not, I mean, if I put this on YouTube, you'll see it, but on a podcast, she's got the biggest model of a mouth that you've ever seen. It's bigger than her head.
it almost is, isn't it?
It's bigger than your head.
The kids love it. The kids love it.
Yes, I love it.
Yeah. So if the tongue is kept on the floor of the mouth, it doesn't go up there. And so then you get a more narrow arch. And then we start having, we need braces. We can't breathe properly, and we get sleep apnea potentially later on in life. So again, that is one of those structural things. If you're breathing properly, if you can get oral function, is one of the things I look for. And that's actually a fun one. And it's very common, varying degrees, and not all of them need surgery. Some of them just need therapy to teach to deal with compensations, but some of them need a little procedure so you can get function. So,
should your tongue be on the bottom, or should it be on the top?
When you're on the top completely.
When you're breathing, show me the big hunkin' model again.
Yeah, so when you're not talking and when you're not swallowing, drinking, eating, the whole tongue should be resting at all ages, should be resting. And one of the things you'll
resting on the top?
On the top.
Oh my gosh. Mm-hmm. See, who would know this?
Well,
we're going to find out today, but who would know this? No one would know. I certainly don't, or didn't.
Right. And what's interesting is even if you then get, let's say if it is because it's restricted, just because you get the restriction removed, now it doesn't mean the tongue automatically goes up there. And that's where physical therapy comes in. And that's where I come in. So I help patients prepare for the procedure and help them afterward to get the function that they need. And that's the same with other conditions, like just mouth breathing. If people have had asthma as children and they've dealt with it, they grew into a habit of mouth breathing. And suddenly, just because their asthma is under control doesn't mean that the tongue now goes up where it needs to do and the lips close. And one of the things I encountered as a clinical hygienist repeatedly were patients who would come in with sinus issues. They're very common in this part of the country. And some of them would get surgery. And I would always ask, so did surgery make a difference? And most of them would say, yeah, it's better. But not rarely would they come in and say, oh, it's just night and day and everything is gone. That doesn't mean the surgery wasn't necessary. The surgery was very important, most likely an important role in the treatment. But just because they now could breathe through their nose didn't necessarily mean they knew how, or that, it's when we breathe, we don't think about it. So that's where physical therapy can make a big difference.
Interesting.
Yeah.
And so is this mainly for children?
No.
Okay.
No. So what's great with children is that we can actually prevent. And we can prevent skeletal growth dysfunction that can lead to sleep apnea and clenching and narrow arch and ortho and cavities and dry mouth, et cetera, et cetera. So we can prevent. But for those of us who are now adults, there's still great things. So for sleep apnea, for example, they actually now show research that just adding myofunctional therapy for a limited time, you can reduce sleep apnea up to 50% in adults, and it's 65%, I believe, for children. But
could people get rid of their CPAP machines?
So I never promised that.
Okay.
I never promised that. And I think CPAP machines are lifesavers.
Yeah.
It all depends on the severity. It can make it easier to use. If people have mild, they may be able to move to an oral appliance. People who have an oral appliance may be able to not need an oral appliance. I never promised that. But it can make a big difference. But with any physical therapy, we have to do our part. Yes. And so there's the human factor involved too, which is one of the reasons I never promise.
Yeah. And so when you say oral appliance, are you saying that they have to sleep with something in their mouth?
Yeah, so there are appliances out there right now for milder cases of sleep apnea that actually just shifts your jaw a little bit to open your airway. And so you don't need the CPAP because you just plug in, I'm just going to call it a night guard. Many of your listeners probably are familiar. It's not the night guard, it's something different, but it's an appliance similar, or we can call it a retainer, some form of appliance that just pops in your mouth, and it just repositions your jaw to move it forward a little bit, which will then open your airway and you can sleep better. And for some, that's all it takes. That reduces their episodes of apnea or lack of oxygen enough that they're good. They don't need the CPAP machine. And some can go from one to the other. Sometimes they go from an appliance to a CPAP. Or sometimes they go from a CPAP to an appliance. And the goal, of course, for most people wouldn't it be nice if I didn't have it? So people sometimes try and see if that's possible. And oral function can play a role. It's not the only thing, but it can play a big role.
And the appliance, you can't swallow it, right?
No.
Okay. No. That's what I would worry about. Like, oh, what's going to happen in the middle of the night? I might swallow it, but you can't because of the way it's built.
Yes.
And then are they built specifically for that person's mouth, or are they just one size fits all?
No. You would see a sleep specialist. Usually it's a dentist with additional training in sleep appliances and airway awareness and education. And so you would see a dentist that is specializes in sleep and airway.
And would they measure your mouth, and then would they build a mold?
So there are different ways of doing it. Nowadays, technology is so great that it's often just a scan. That they can scan the days of a lot of material in your mouth. Those days are slowly going away. So you don't necessarily always have to have a lot of impression material in your mouth.
This is such great information. Can you look at someone and know what's going on with them? I mean, can you go out to coffee with someone and look at the way they're talking, and then you're thinking to yourself, oh boy, this person is a mouth breather. They don't breathe through their nose very well. I can help them. Can you spot it just by talking to someone? Well,
I think it's very common to see mouth breathing. And once you look for it, you can never unlook. So even you and your listeners, next time you go grocery shopping, you're going to start noticing.
Oh, I probably do that. Although, you know what? When I go to bed, I do have asthma and allergies, but my asthma is way under control for years now. I'm so happy about that. But I do notice that if I do sleep with my mouth open, I get dry mouth, and I'm just, it's terrible. So I think most of the time I've trained myself to close my mouth, and it's so much nicer in the morning because you get cotton mouth when
Yeah.
you leave your mouth open. So, and I can't stand cotton mouth. So I've learned to close my mouth when I pay attention. Sometimes, how do you learn to pay attention to it all the time? It just has to be a habit that you have to start.
Yeah. And myofunctional therapy it's usually a long process. So
Okay.
I see most patients for 6 to 9 months.
Oh,
And I see them for, every other week approximately. That can fluctuate depending on where we are in the therapy. And so to change habits, it takes a lot of time. Time is a factor. And also the different exercises that just sort of gets your tongue used to being where it needs to be, the lips used to where they need to be. And so there is the time factor and the exercises and awareness. And I provide what I call active exercises, which are exercises you do in front of a mirror. And then I do passive exercises, which are exercises you can do while you're cooking or reading. And then awareness exercises, which are the ones that you just they're little different exercises that it something brings you to the attention of, oh, are my lips closed? And we have little tricks for that. We have specific awareness exercises, and those kind of things will help. And we work a lot on when it comes to mouth breathing, for example, what you do during the day first, because that will carry over to the night. I can't start working on, let's just take your lips and make sure they're closed before I know you're actually able to breathe through your nose during the day.
do you actually do that?
I do.
You tape the lips closed?
Yes.
Wow.
So, and again, that sounds scary, doesn't it?
It does.
Yeah. And again, I don't recommend anybody just do it, right away. But yes, that can be part of it. And it provides great sleep for the right people, including myself.
You mean you tape the lips before they go to bed and then they have to keep it on all night?
Well, they do it themselves, but yes. And it's just it can be a little piece of tape and it can go like this.
Oh, I thought you meant it went over your whole mouth and then you have to rip it off like a Band-Aid in the morning. There goes all your skin.
There are many different types. And so some of them are they cover more than others. But for many, it can be a little piece that just sits here. So even if they need to cough or something goes wrong in the middle of the night, they still can. Okay. Just like I can talk right now.
Yeah.
But just closing the lips and then, being aware of where your tongue are when you go to sleep. You can wake up feeling a very different person. You
just reminded me of ventriloquists. They're probably good nasal breathers, right?
Yes. And they're good at keeping their lips, even if they're slightly open, that you can barely see it. But you talked about the cotton mouth, and dry mouth is such a huge problem, and it's so common. The vast majority of medications that are prescribed nowadays actually produce dry mouth. It reduces saliva.
I've taken some that have done that, and oh man,
yeah,
it's terrible because no matter how much water you drink, you can't get rid of it.
Right. And actually, almost sipping too much water makes it worse. Because it can remove some of your natural enzymes in your saliva. Your saliva is magic. It has all sorts of features to it. And if we sip it, a lot constantly, we can actually sort of reduce that. That takes a lot. But for patients who struggle with dry mouth, if they also mouth breathe, now you have a double doozy. And they'll be much more prone to cavities because the pH, things stick to their teeth more. It's more acidic in the mouth. So if we can help patients nasal breathe who are struggling, also healthy people who don't have a dry mouth, but if nasal breathing can make a very big change for patients who struggle with dry mouth from their medications.
So when you're talking, you're breathing through your mouth when you're
talking,
right? I notice when I do a lot of podcasts, I get really dry and my throat starts hurting. And then I'm like, I cannot talk for the next 2 days because I've worn myself out talking to people. And is that because I'm breathing through my mouth too much? And is there a way to stop that when you're talking?
I'm not a professional speaker. Um, I think a lot of speakers will have a glass or a bottle of water next to them and sip once in a while because, yes, you are speaking. So you are drying out, airing out. And I don't think it is possible. I even heard, I'm not very good with names. It's a dentist who is very focused on nasal breathing and breathing techniques. And he's even been trying to do his seminars and trying to nasal breathe, and he can't even do it. So I think when we speak, we tend to breathe through our mouths.
Okay.
Yeah.
Wow. I was just wondering that because I just remembered that when I talk too much, I mean, it really affects me. It really affects my throat. Even if I'm drinking water during talking, if I do it too long, it's like I can't do it for another couple of days. I have to kind of just rest my mouth and close my mouth. I think I'm pretty good at closing my mouth. Even at night, I think I just keep it closed. If I feel like I've got cotton mouth, I close my mouth, and then I kind of like let the saliva, work its way, whatever it needs to, and it seems to help.
It does. Saliva is magic. Now, it's an interesting point with the speaking, and there are speech pathologists who focus on public speakers. And so some are also, since this is a field, myofunctional therapy is a field that is geared towards speech pathologists, then you can find speech pathologists out there who also have myo training and have public speaking or focus. Someone like that, I'm sure, would be able to say a few things and guide you and say, oh yeah, and here are the tricks.
Oh gosh, you are just a wealth of information.
I don't have that quality. I'm not a speech pathologist. But they're so wonderful to collaborate with because we come from two different sides, but both have oral function in mind. Yes. And so they teach us and we can teach them a little bit. And it's a great relationship. And
you're a great resource.
Yes.
You know all the people to go to. If you can't help, you're like, well, I'll send you over here. I'll send you over here. It's great to have somebody like you.
And I definitely don't have all the answers. And so when I don't, I try and be very upfront and say, I don't have the answer, but I think let's try and consult with someone else. And yeah.
And so you said that it can help with headaches and neck pain?
Yes. In fact, a patient I just finished up with last week, she came to me, her general dentist sent her, and he felt that maybe she had a restricted frenum or a tongue tie. And she had complained of head and neck issues, chronic, and had a limited opening, and had a series of things, headaches, clenching, and tension. And we have gone through therapy. And when she got her frenum released, I was there with her. It was such a pleasure. It was an honor. She let me be there because that's not something I do, but I work with a provider who does. And her eyes just went wide. And as soon as it was done, and she said, and she did this, she said, I can move. And so we have fascia that is entwined with everything. And so our tongue is actually basically connected to our toe in this sheet.
To our toe?
Yeah.
Our tongue is connected to our toe.
Basically. Okay. Yeah. In this network of fascia that goes around and through our organs and our body parts. And so if this is restricted, there are restrictions other places that now we try and compensate with because we need to breathe, and we can get to walk a little funky. I mean, it's so fascinating.
So what about a person who does, what is it called? What is it called? I just had it. I'm tongue-tied.
Well, in that regard, that's not correct for use of tongue-tied.
I know. A reflexologist. So when someone's working on your toe or your foot, can that help fix your tongue or do something with your tongue?
Sometimes we need both to be addressed. So in this particular woman's case, as soon as she was released, her forward neck suddenly corrected about 50%. And she could suddenly move her shoulders and move her head in ways she hadn't been. And yet, if you had just met her on the street, you wouldn't have thought that she was stiff. And then she hasn't had, here towards the end of the therapy, her clenching is gone, and she hasn't reported a headache. She had a headache, she had the flu, and she said she had a headache, but she hasn't had a headache in several months. And it's the release plus getting the function, and it's not black and white. She still has some tension. She still sees a craniosacral therapist that's working on releasing that, but it improved things, and she's on a path. So yeah, it's really fascinating. And so in her case, she didn't feel a change in her knee, in her toe, but I have heard of cases where people will sit and then they'll go up and get up and think, my knee feels different, because it's all connected.
Wow.
And then they need, if it's the knee that's issued, they need physical therapy by a physical therapist who can help them recover from the change that's happened to their body because of the mouth now has affected. There's a big link between our pelvis and our airway. So,
what?
Yeah. If we have pelvic floor issues, they're linking it to airway issues. So again, what's so fascinating about this field is that we have to work together, and it's crossing bridges that we're crossing bridges that the bridges weren't there before. So it is fascinating to collaborate with physical therapists, with speech pathologists, with ENTs, and body work and allergists. And yeah, it's a lot of fun to gain quality of life for patients.
Wow, I feel like I need to call you and go see you. Gosh. So people come in and they have a consult with you. And how long is the consult normally?
So they fill out some paperwork, some forms. I ask all sorts of funny questions.
Okay.
And they send that, they fill that out ahead of time.
Yeah.
Funny question. And then they come in for an assessment. And that usually for adults, takes about an hour and a half.
Okay.
I take videos, I take pictures, I have them do some exercises, I take measurements in their mouth, and I ask a ton of questions about how do you sleep, how many hours do you sleep, do you kick your legs when you're sleeping, and then we talk about digestion, and we talk a little bit. I just ask all sorts of questions, but it usually takes about an hour and a half. And then if I feel like then that circles back to, is there an issue with the nasal breathing? Is there an issue with mouth open mouth posture? Is there an issue with the swallow? Do you move your tongue when you swallow? Is there an issue with just the tongue not being on the palate when it needs to? So I circle back to that, and then I compare that with all the other information I gathered, and then we come up with a plan as to what would be
That's
best.
like a fun assessment.
It is. It's very eye-opening. I mean, because I'm a dental hygienist, I would love to see that being part of any new patient exam in a dental office. As it is in my office, that's not realistic, but because it's educational for patients, and it's very educational for any provider that's working with a patient.
Boy, it sounds like it. And then you said you see people every other week for how long? An hour? Or
so, yeah, it's usually about 40. I always schedule an hour, but anywhere from 30 minutes to an hour. Yeah.
And then sometimes it goes 9 months, or sometimes it's 6 months. It just depends on the patient. Right?
And sometimes it's 2. But for sometimes, if the therapy can be a little more specific for children. So children can we can do a little bit shorter programs and then let them grow. And then we add more support, more myofunctional therapy later if needed. But for some children, the programs can be shorter. Most adults it's all connected. If we tend to have a low tongue posture, we're also mouth breathing, and then we're probably not swallowing right. So we have to go through, making sure all of it. And that usually takes about 6 to 9 months.
Oh my goodness. And so once they've gone through therapy for 9 months, is what they're left with a permanent fix?
That's a great question. Because
patient,
yes, that is a really great question, because patients will say, do I have to do exercises for the rest of my life?
Yeah.
And the goal is no. The goal is for the answer to be no. I always wish that my patients will walk away with the awareness, and that will be with them for life. And so they'll hopefully always, when they're sitting in the car thinking, are my lips closed, for example? And so there will be an awareness that will be with patients. But the exercises, it's what we hope for is to create function. So we're not doing exercises for the sake of exercises. We're creating exercises to gain function, and that function should remain. And so unless other health issues suddenly come into the picture later on. So yeah, once you're done with therapy, there shouldn't be any more exercises to be done, except being aware and know that your goals are always nasal breathing, lips closed, tongue on palate. And then the swallow is a little, that takes a little more for an awareness. But yeah.
This would be great for anybody to just go get, right? Yeah. I mean, anybody, I think well, in my opinion, everybody should go get an assessment.
Right? Yeah. I mean, I obviously agree. I think we can all learn. When I started going down this path, I'm like, oh, I have all these dysfunctions myself. My son has all these dysfunctions. My husband, it's very common. We're not perfect, right? No. We're not. And so, but we learn so much about ourselves in the process. And just because we have a lot of dysfunctions, they don't necessarily all need to be addressed. They can just be, awareness, and some may need addressing. So
I can't wait to talk to my husband about this. He has this thing where he goes to sleep, like he takes a nap on the couch. And I know when he's awake because he chokes every time. I'm upstairs, he's downstairs, and when I hear the choking, I'm like, okay, I can go down there now. He's awake. And I don't know if it has something to do with his keeping his mouth open or not breathing through his, I don't know what, but now you're making me think, like, does he need to go take all these tests, or maybe he just needs to come to you and you can do it.
So does he go to sleep after he chokes? So does he sleep and then go and then goes back to sleep in the middle of the night? Or is this now when he gets up?
Just like naps. He'll go on the couch or in a chair or something, and he takes a nap, and then he just chokes. He doesn't do it in bed when we go to sleep. He does it when he's in a chair or on the couch, and he's like massively choking. You know how like sometimes you swallow the wrong way in the middle of the night, and then you start choking and you're trying to, stop it's like that, but it's just every time he's on the couch. And so I think he did a swallow test and it was fine, but you make me think now that maybe he is breathing wrong. Can that be?
Yeah, position. It sounds like if he has no problem when he's in bed, it sounds like position is creating a difficulty that then catches up with him. You should sneak in and see if he breathes through his mouth when he's sleeping.
Oh, I'm going to be watching.
You can never unsee it again, unknow it again.
What about, like, this is going to be a really stupid question, but you just keep making me think of things. What about like a dog? Dogs breathe through their mouth, right? And they're always, panting. So can a dog get help with that? Unless, they don't choke. They can't tell you that anything's wrong, like headaches.
And I don't So I'm not a vet,
I
and
know.
this is by no means my expertise.
But I'm sure you know a
Um,
lot of them that you can refer people to.
I think dogs are in much better shape than we are. So when they
Oh,
need to breathe structurally, we have messed with our structure for a long time, which is why most of us don't have wisdom teeth, because our faces anyway. We've messed with it. I
interesting.
think dogs are, for the most part, in much better shape than we are. So when they mouth breathe, there's a reason. That's also how they gauge their temperature, right? They
Right.
body temperatures through the
That's
tongue,
right.
and so yeah, if we don't want to take that away.
No.
So yeah. So in general, I don't know how this would refer or work for a dog.
Yeah. Uh, are there any success stories besides that one that you can share?
Well, it's success in that it is, a little boy came to me, and his his grandmother was a hygienist and had heard a little bit about, myofunctional therapy. And this little boy, who was 6, had a really hard time going to the dentist. He gagged on x-rays, and he didn't want anybody in his mouth. And they knew that there were some issues with crowding. And what's so great is that they brought him to me for an assessment. And it was very clear that his skeletal growth was very different, or deficient, I would say. It's not ideal. And he had an issue with his tongue, and he had a hard time closing his lips. So at coming to me, what is a success is that we started working on just closing the lips and having a fun time in the process, and connecting him with the right orthodontist who can help with the skeletal growth that has already happened, and guide it as he's growing. So he came to me for a while, and now he's seeing the orthodontist. And he is in great hands with this particular orthodontist, because she's very aware that it is not about getting straight teeth. It is about making room for the teeth, and so that the jaw development can happen correctly. And then once the therapy with the orthodontist has reached a certain point, then he will come back to me for more myofunctional therapy. So I think it's a great success for a child, because that's where we needed to go. We ruled out allergies. We ruled out that yes, he's capable of breathing through his nose. So that's great. So by coming again, what is success is that we know he can breathe through his nose. So that's not it. And now we can start addressing it. And again, if we're not breathing right, there is some link to hyperactivity. So in children,
Oh,
if they don't sleep well, so children, for example, we think it's cute when babies snore. It's never cute when children snore. It means there is an obstruction. And if
oh,
they're not breathing right when they're sleeping, then they're not sleeping. They don't get the quality of sleep they need. And so then they get hyperactive during the day. And the rest of us as adults, if we don't sleep well, there are different ways that shows up. One of them is that we get up to go to the bathroom a lot. And we think we wake up because we need to go to the bathroom, but more likely we realize we need to go to the bathroom because our bodies is waking us up, because it's in fight and flight, because we're not breathing right.
oh,
So
really?
yeah. So if we're in fight and flight, we're running from the tiger. So we need to go pee so we can run from the tiger.
Oh, oh.
Yeah.
And there are a lot of people out there that snore
Yes.
that don't necessarily have sleep apnea.
There is a
Oh,
long evolution before you get sleep apnea. You can start with a certain issue, and along the way comes snoring. And for many, not everybody, nothing is black and white, but for many who have sleep apnea, they started somewhere with snoring, and with time that became sleep apnea.
so you might be able to help it before it even gets to sleep apnea.
Yeah.
If they get to you in the snoring stage.
Yes. Yeah.
Oh my gosh, this is incredible information. Well, thank you for doing this today. And where can people find you? I'll put it in the show notes, but just in case people aren't going to read the show notes, where can they find you?
So my practice name is MI Myo. MI stands for Mercer Island. I have an office on the north end of Mercer Island. My website is myo therapy.com. Or you can call me at 425-298-7801. And I always start with a chat on the phone. So even when someone is referred from a dentist or whether they find me online, I start with a chat on the phone and we see if we think an assessment is indicated, and we just chat. And if not, it's non-binding, it's complimentary. So feel free to give me a call.
And can people do Zoom calls with you?
So the short answer is yes. I always do my initial assessment in person. And my preference is to do therapy also in person. However, I also do it telehealth. And so sometimes I sort of fluctuate. So if patients have a hard time seeing me in office due to their schedule or for whatever reason, then we'll do maybe every third one in the office, but do the rest via telehealth. So yes, but always the assessment. And children I see in person only.
Okay. Well, thank you for this information today. I mean, I'm sure a lot of people had no idea that this kind of treatment was available. I mean, I didn't know, and I'm sure a lot of people are like that. They had no idea. And you are such a wealth of information. This is very inspiring.
Well,
Thank you so much.
Well, I appreciate being able to share this. This is, we call it a rabbit hole. Everybody in the profession around airway say, you go down the rabbit hole, and an osteopath said to me a little while back that it's not a rabbit hole, it's a black hole.
Oh,
we get a little crazy, and we keep learning, and we keep, collaborating, and it is fascinating. But I appreciate sharing it. You can probably sense I'm a little excited about this field.
yeah. Well, I am now too. Now I want to go study it. Well, thank you, Dee.
You're very welcome.
Have a great day. I'll let you go now back to your patients.
Thank you. Have a great day.
Bye.